All right. Good evening. Welcome to the Government Operations Committee. It's Monday, December 2nd. It is 5:46. For committee members, we have in attendance Councillor Trimble, Councillor Dean, Councillor Beck, and Councillor Mallard may be joining us remotely. And I'm Suha's chair. We also have around the table Councillor Leonard, Council Chair Pelletier, Councillor Fish, and Assistant City Manager Courtney O'Donnell. So our agenda looks kind of scary, but I don't think it's as bad as what it looks like.
It might be. Yes, thank you, Councillor Hawes. The first item is overview of projects in progress, and I do have a few department heads that just want to give kind of a quick overview on their area. And first up is Phil Drew, our city assessor. He's going to provide an update on our citywide revaluation project.
Oh, Councillor Leonard?
Just really quick, is this gonna be separate from the overall revaluation, or are you combining, both the project, I'm sorry,
It's a part of item number 1 on the agenda.
okay, so we're not, yet going over, oh, okay, thank you for the answer.
Proceed.
Well, thank you. So I'll just be talking about the revaluation overview and really how that impacts the assessments as of 2025 and 2026. Just to make it clear for you folks and the public to know what is being impacted by the revaluation specifically. So just in review, we've hired KRT Appraisal and we've gone into a contract with Catalyst Software so that we can have a much more robust assessing software system. Really the main purpose of the revaluation is fairness and equity among all the property taxpayers with different property types. Really the phases of the revaluation, data collection, then after that would be sales review and validation, market analysis and valuation, a field review by KRT with each property assessed value, someone going out and actually looking at the assessment and looking at the property and see, does that seem accurate? Just from that viewpoint. And then really the informal hearings, most of that will occur in 2026. And the contracted delivery date is July 24th, 2026. And those would be used for fiscal year 2027. So I'm happy to say that KRT arrived today with their 4 data collectors. And then the packet has the profiles on each of them. There's a Corbin with an IN, a Corbin with a YN, there's Dan, and then there's Oscar. So they'll be the 4 principally out in the public. And really they're starting on the west side, pretty much near the golf course. They have a batch of say 500 properties. The good thing is that we've had wonderful assessing work in the 1940s that has been maintained as far as sketches are concerned. So when they show up to your property, they'll already have a digital sketch that relies upon our sketch. They're simply just validating that those are the correct measurements for the structures, and that will really kind of improve the efficiency instead of having every individual property measured. That would take additional time on the property. And we really just encourage all owners to, consider letting them in to do an interior inspection. It's up to the property owners themselves to make that determination, but the better information that the data collectors can rely upon, I think the more reliable the result will be.
Councillor Trimble?
Actually, I called over the weekend, somebody about that question. They said, well, what if I don't let them in? How's it affect? I said, I'm not sure. I said, they obviously are gonna look at the outside. I'm assuming, do they just assume it's an average condition on the inside if they don't get let in?
I would hope that they would look at the exterior condition and
get it.
use that as a
sense of-
guide.
yeah.
So we think if all the neighbors have similar exteriors and they're in some of the interiors, then they're probably gonna see what the general trend is in that
Yeah.
neighborhood. As far as conditions, so the best way to know for sure is that if they're allowed in. Or if the property owner gives information directly to the data collector while the data collector is there, like maybe a quick interview on the porch. If they're uncomfortable with them coming in, but I could say with the years of experience that these individuals have. The interview process is much longer than the few minutes that they would be inside. And you know, when they show up to the property owners have already received their postcard in the mail notifying them that they would be in the area. They'll have their badge. And they'll have my municipal letter of introduction. They can show that to the property owner. You have in the packet, the profile on each of the data collectors, and that has been given to the police department. If anybody is concerned, they can check in and you can just verify that, yes, that individual works for KRT and
Counselor Forney?
Like they were on Webster Avenue this afternoon.
Okay.
I was out walking my dog. I took the dog off leash. Right over and barked at them, but they were very, very good. And the cars have that thing on the side.
Yep.
So it seems to be going well. And so he was walking the property lines. So
Counselor Fish?
The postcards that were being mailed out to the residents, I think they went out last week. And though, are they, is there one postcard? I'm just thinking if this is process gonna take over a year, some people may, if people got them all this week, they may forget. Or are their postcards gonna go out in increments depending on where the assessors are?
yeah, I think they work in
They're gonna go,
an area of like 500 properties. And they'll send those postcards out
okay.
and then they'll work that over the next few weeks.
Okay, thank you.
Counselor Dean?
Yes, I was just wondering, in a few weeks, could you give us an update on how people are responding to the
Yep.
assessors coming to the door and
Yeah.
the knocks, and how many are being let in, just maybe so we can figure out if it's working or not and what we might need to tweak?
Counselor Leonard?
I do have quite a few things that don't worry, Phil, it's not scary. Microsoft 365 has are we still waiting to implement that so far, or is that or are you and rest of the office able to access that yet?
I believe that's been implemented.
Yeah.
Okay, perfect. Looking forward to having another discussion with you regarding how we can best train employees and develop them with that technology. Additionally, I think and I'll cover this again once Lisa comes up. Adobe AI is really impressive to me. It's able to read PDF documents, something that would, I think, help us out quite a bit, especially for some of those pesky documents that are that occurred before typewriters. So that could be immensely helpful there. Additionally, and this is more of a macro thing that I think we should at least be aware of, and please answer if you have any your own thoughts on that. Because we're doing a lot of rezoning in the city, and because we're going through a citywide revaluation, I am concerned that there are going to be some unintended gentrification consequences related to the overall socioeconomic migration between different individuals who live in the city. And where that could be a huge concern, for example, is actually with our school districts. So there's nothing we can do about this right now. We're going through the revaluation process. I would like to, at some point in the future, have a discussion whether or not that's something that we should be reconsidering in regards to how we go to a school committee and have a conversation with them regarding if that's something that we need to consider school redistricting. And the only reason I bring this up is, I read a story the other day regarding a Lewiston school, Montello Elementary School. I don't know what the issues were related to that school, but there were staffing issues related to kids that have more education needs, like more ed tech individuals. And those costs go up tremendously if a school is already short-staffed on some of those employees anyway. And I would but basically, to summarize it all, I do have concerns about that. I don't think they're going to affect us right now, but I would like us to put a pin in this topic for the future. Is this something that you think could affect the overall equity, socioeconomic equity of the city? Just because we are rezoning a lot and we're going to be doing a revaluation.
So we don't really collect and process too much demographic data. There was a time a few years ago that I was asked, you know, is there some issue with equity under different conditions? And so our approach was to just say, okay, well, why don't we do our ratio studies and analysis by
It's
by
okay.
census tract. And actually, when we did that analysis by census tract, it almost showed almost perfect equity by census tract. So as opposed to saying our neighborhood that we've determined, so it showed equitable values then. So that's the only way that we've ever kind of considered like any demographic information, just using those census tracts. But we haven't really gone any further.
That's totally fine. This is obviously the first time I brought this up. I don't know if this has been brought up to councils in the past. It's just I think it's worthy to take into consideration. The only other question I had for you was actually regarding Catalyst. How's the transition been to that new software? Any hiccups so far? Are employees having how's the response from employees so far?
Well, really just last week, we moved out of production, as they called it, so that we're fully functioning with this software because KRT was still making changes and updating tables. But we're all able to use it. It's easier than we thought it was going to be.
Good.
So we're, you know, there's certain things that we do in both systems. And that's working out better than we thought. So I would say overall, it's going pretty well now that we have the full model. And we can use that to start to prepare and for when we have it all to ourselves in July of 2026.
All right, that's all I had for right now, Phil. Thank you so much for updating us, and looking forward to the next time.
Just to Councillor Dean's question. So their KRT is required to come anytime we would like them to. I guess one question for the committee would be, is there a schedule of dates that you would want to hear directly from KRT as far as their progress is concerned? I would just open that up to the committee if they would want to hear directly from KRT themselves in the future. We don't have to have the dates now, but they're willing to do that. Kind of like having the contractor, you know, this big house. You're like, we need to hear from you directly sometime. So if it's the committee's wish.
I would be interested in hearing from them, but not setting a time right now as far
Right,
as,
no.
yeah,
Okay.
they're just getting started anyway, so. He'll be around a while.
The only other thing I really wanted to cover, but just make it clear to counselors and the public is April 1st, 2025 and April 1st, 2026. So the city will still establish equitable values as of April 1st, 2025. So, and KRT will develop the values for 2026. And in my memo, I just had the example of, you know, what happens if the assessing department goes out in a couple months and picks up a new garage at a property? Are we going to use any of the data collected from KRT? And so our answer is no. We will only rely upon our data for the April 1st, 2025 valuations. KRT's data, they will only use for 2026, so there won't be any commingling of data.
Courtney. It's Wayne, he's up there. Counselor Trumbull.
Yeah, well, Phil, suppose, they started today on the west side of this week.
Yeah.
Suppose they did a property on Webster Avenue and they finished it today.
Yep.
And then this fall, somebody puts up a garage. Will we catch that for next year's? Are they gonna have that on the 2026? Okay,
When did they build the garage?
this fall they put it up,
Oh, this fall.
yeah,
So
so,
we'll probably.
I mean,
pick
not
up-
this fall, say they put it up in February.
Oh, February.
Not likely over the winter, but say it happens.
Yeah.
In February, so we'd have it on the April 1, 2025. Are they gonna have it on their April 1, 2026?
So we
Because
would,
they've already done it.
in our normal course of work, we would be out to the property and pick it up and measure it in February.
Mhm.
It would be part of the April 1st, 2025 assessment determined by us.
Right,
And then it would just be in,
but they would update theirs as well for April 2026.
right, if they had already seen it
Right,
ahead of us, they've already.
that's what
done
I'm
it.
saying, they've already done that property.
Yeah, yeah, but we're just not gonna be looking to their system.
Right,
Even though we have access to it, that's not our focus.
Shelley. You had your hand up?
Nope.
No?
I'm
Counselor
not
Jean?
clear here. Are you saying they've already looked at the
they
property
looked at
and
it,
they didn't have it?
right, and then
then
the
it
garage
went
was
up.
up, and then we'll get it on our
And
book
then
for
you're saying
20.
this is-
They'll
put
update
it to
that.
KRT
Right.
for the 2026
Um,
or not? They've already assessed this property without the garage. Then you find it, then do you update KRT for 2026?
So they're gonna have access to our building permits. So that building permit would be in their stack of stuff to review. So they should be going back to that property
Mhm.
and picking
Because of
that
the
up
building
on
permit.
their own.
Any other questions?
There's one. So when we started talking about doing a reval, and obviously we're looking at reassessment from an equitable perspective effective April 1st of 2026. Phil, you talked about oftentimes when community is in this process is they do not make market-based adjustments. So are you still thinking you are not going to be making any value adjustments for April 1st of 2025?
So my thought on that would be to make the equitable adjustments to get properties to say 91% of market value. Closer to 91% instead of, because if we're below 91%, the state would make us adjust all of the exemptions. And technically adjust all personal property. Different classes of property have to be assessed at the same percentage of value, so if we were saying 85%. If we kept it there, based upon residential values, then you'd have to lower the values of commercial industrial. Down to what we thought was 85% of market value and personal property down to the common level. So whatever that common level would be. So I was hoping to have a common level of 91%. That just got us to the bare minimum to have full exemption levels.
Because we've been shooting for higher than 91% on an annual basis as we do our market-based adjustments internally. And I know early on we talked about kind of, it's not uncommon for the assessor to put a hold, if you will, on a lot of those market-based adjustments in anticipation of. But his point about it, you're below that level, it does impact your taxation of all property as well as your exemptions. So,
And I think my last sentence really is having assessed values near market value in 2025 is gonna lessen the impact of the revaluation as much as we really can, can produce for the taxpayer. So that's always our goal, our focus, so make as little change as possible. That's necessary, little changes, that's necessary. Wonderful. It's a great day. They started.
Thank you.
Yes. And then up next, we have Lisa Goodwin, city clerk. She's here to chat a little bit about clerk and treasury and how that department's going.
Good evening. So it's been about a year since we physically combined the clerk's office and the treasury office. And it's been a year of learning for staff because they each needed to learn the other side. So we've come full circle and they're going back into the new dog season, but now they're learning a new dog program, which isn't very easy to use. Anyway. So last year when we merged, one of the first things we looked at was the bank deposits. They were not being made in a timely fashion. They were weeks and weeks behind. The auditors reported on that. Now they are done within 1 or 2 days that those bank deposits are made. So those have been, we changed some processes and that has happened. The other problem that we experience, and this goes up and down, for a year, I've been watching this, is the mail, when the mail comes in. Depending on what other things we're doing, like for the presidential election, we couldn't touch anything. We were so busy just with absentee ballots and stuff that we were not able to do anything with that. However, finance had somebody from Bonnie Staffing in. They've been helping us, and now that the office is back to normal, the other staff is working on it, and we are just 1 day behind now. So we went from 6 weeks down to 1 day. So within the last 3 weeks, so I'm happy to report on that. And now that we won't have a year like this year where we had 3 elections, we'll have an opportunity to move some people around, take them off the counter and see how that works. And see if that alleviates that problem that we're having with that. So I'm very hopeful for that. Other than that, we will be getting back into our indexing of records and doing all our boring stuff that we do. So, any questions?
Do we have questions? Councilor?
I mean, you addressed my biggest concern that I had with the department. I'm glad to see that a huge shift has been made there. Like, I commend you for that. But thank you so much. I do want to make sure that we can prepare you for the next crazy election season, though. And so I know we're not gonna solve anything tonight, but I am interested in ways that we can automate a lot of your department's work. And I know Microsoft 365 will help in probably a lot of different ways. And I do want to allow employees to develop themselves more by I would be completely open to even paying for classes for them to train themselves on how to use Microsoft 365, just so that they could incorporate it into their daily work life more. In addition to this, and I haven't talked to you about this behind the scenes yet, but I've recently come across just how useful Adobe AI is with reading PDFs on its own. And I don't know how that in particular could help your department, but I know it can. And so we'll talk offline, and I definitely want to, we've talked about this before, to take a closer look at your department. But I think your department, more than any other in the city can heavily benefit from introducing this new technology into both the combined treasury and clerk's office. Did you have any thoughts on that? It's okay if you don't.
Well, I was waiting, we were gonna have a meeting to
Yes,
talk
yes,
about it further. Yeah.
wholly my fault, have not come back to you, but I am looking forward to that. So we'll talk offline, and we'll schedule that, but I don't have anything else to add, but besides that, just again, I commend you on the good work of your department. Thank you.
Thank you.
Any other questions? Comments? Council Beck?
Just had a question. You had mentioned about the difficulty of the software, about learning it. Are you, or is the department open to possibly looking at other software?
It's actually something that the state implemented, and we don't have a choice. What we had before was easy.
Gotcha.
But what they have implemented is really, it's horrible, and you will hear that from every clerk in the state,
Yeah.
that it is horrible.
Yeah, well, I agree with you. I went today to pay my sewer and it was 2 windows, having to calculate things manually on one screen, run the card through, then go back to the other screen and. Yeah, so the state of Michigan, or state of Maine, that's what we gotta talk to about that, it sounds like.
Yeah, the legislature mandated that they implement something, and I don't know where they found this program, but they did not ask the clerks to test it out ahead of time. Normally, that's what the state agencies do, is they ask us to test it out, to show them where the bugs are or what isn't working, what does work. Like with the state's voter registration program, we've been right with them through the whole process, but animal welfare did not do that.
So it sounds like something maybe we need to bring up during maybe our next legislator meeting. You know, hey, how do we switch this back? Thank you.
Any other questions, comments?
I just keep popping up, sorry. So I just wanted to provide an update too. So what Lisa's referring to is the new dog licensing that is state mandated. And where some of our delays were happening, we're in our TRIO system, which is not state mandated. So our TRIO system is how we generate real estate, sewer, stormwater bills. It's also how we register vehicles. So I will tell you that the number of systems that through which you can register vehicles is also dictated by the state of Maine. Because you have to be an approved provider to be able to do that. We just completed within the last 2 or 3 months an upgrade in what's referred to as TRIO, which is where the real estate, sewer, and stormwater come from. We just upgraded to the Windows version. And now that we're on the Windows version, there is now potential solutions available to us so that people can schedule their online payments and they can receive their bills electronically. Until we moved to the Windows version, we didn't have that opportunity. So TRIO has created a partnership with a third party that creates the secured site through which to engage in that kind of a transaction. Because, for example, the city does not maintain. We use third-party providers for all of our credit card processing because we rely on them to ensure encryption and the protection of the data. Once you start bringing that in-house, then you have to become your own cybersecurity police force, if you will. So we just got an email last week about a new opportunity that we'll be looking at is to maybe we can provide an online. People can go in and schedule, they can get their bills. And because it is a partner product, we ought to be able to do the upload and the interface automatically. I think when you were talking with Dave Little at Finance last week, talking about electronic payments, well, if they're just coming into our bank, they're very difficult to identify. But by having sort of a partner relationship, we can upload them and interface them automatically.
Nice. So,
I'm going away from him.
Should be back.
Shirley Allison Sunset should be back.
Anything else? Great, thank you. All right, moving on to Jen Gunderman to give an update on public health and community services.
Hi, how are you? So in your memo, it highlights a lot of the things that I've come and already provided some updates on, so I thought it'd be helpful to continue to let you know where we're at and certain priority projects. So I won't read through everything, just highlight a few things. On the list, accreditation, we did complete our community health improvement plan. That's at the graphic designer. So once we have that completed, I will definitely share that. That was a collaborative effort that went beyond the walls of Bangor Public Health and Community Services, but involved a lot of public health and healthcare partners to put together. It's really sort of a guide for what are some priority issues and how we want to address them, knowing that there could be significant changes in the way of public health soon. I actually just received information today that Maine Public Health Association received funding from NACHO, which is the National Association of City and County Health Officers, to provide trainings for around accreditation, and they have reached out to us to see if we might be interested. So you'll be getting information on that because I'm sure it's going to involve an MOU. We participated in the PHWINS survey. As I had mentioned before, this is to assess public health workforce development needs. We are so close to getting enough surveys completed for our department that we actually get the aggregate data for our department. And that would be super exciting. I am a bit of a data geek, and that would just be really helpful to understand what our workforce needs are. Opiate settlement funds. So a little change of course here, I think, for a good reason. As you know, we've come to you to present sort of what were some ideas based upon evidence, based upon experiences that our health promotion team have experienced out in the community. And what we heard here and what we heard from a lot of community members and from the University of Southern Maine that's doing some evaluation and guidance around opiate settlement funds is really, we need to take a step back and say, we need to do a better job of getting some community feedback right at the start. So we are actually going to work with our health promotion staff to come together with a timeline on how we're gonna actually do that. But we thought that this was a one-time funding, as you know, well, one time over many different years that really has the opportunity to create great impact in our community. And we want to make sure that everyone in the community who wants to has the opportunity to be able to have a say. So more information on that. I will come back to the encampment closure because that's also sort of ties into Jenna Jones's update. Mosquito-borne disease. We know over the past summer that we saw an increased rate in the number of animals that were tested positive for mosquito-borne disease, like Eastern equine encephalitis and Jamestown Canyon disease. I also learned that there is a emu out there in Bangor somewhere. So what we really thought about at Public Health is, okay, how do we prepare for the upcoming spring, summer, fall of next year in terms of understanding where mosquito testing is happening, understand our own surveillance within the Bangor area, and also how can we do a better job at health communication and education to the different populations in our community. So we have a student intern who's going to be starting with us in spring semester, who's going to help us put together some health education information in a toolkit for different populations, whether it's general public, the school system. I also learned that this was actually part of our climate change plan, was to come up with some of this material and to have a better understanding of the impact of mosquito-borne diseases. So that is off and running, and I hope that we'll be able to be a little bit more prepared from a public health perspective when hard to believe we will have a mosquito season as it gets cold. That's one reason why we like the cold, kills the mosquitoes. I look on my memo. I think the next update was HIV cluster. Yes. So I think the last time since we spoke, the HIV cluster grew +1. There's now 14 cases that are associated with the cluster over the past year and a few months. We've been working closely with CDC. There are still current gaps in the response. We have asked CDC to help us put together a strategy for outreach testing. There's a lot of organizations that are doing great work doing outreach testing, but we need help putting together an evidence-based strategy on where should we be testing, how should we be testing, who should we be engaging with. So we're looking to CDC to help us with that. there has been challenges with linking people to HIV medical case management, particularly with HEAL. And sort of taking a break for a little while. They're still doing some HIV medical case management, but it is not reaching everyone in the cluster. So we've been collaborating with other organizations to make sure that those HIV medical case management services are still available for people so that they can have access to treatment, they can have their medications, they can get all the supports that HIV medical case management provides. Bangor Public Health and Community Services, I'm proud to say, is leading that effort and bringing that collaboration together, including hosting a case conferencing meeting. One of the things, some of the silver linings that have come out of this is all the healthcare entities have agreed upon a shared consent form. So what that means is that people who sign the consent form means that all the organizations providing direct service care can have a conversation about that person to make sure that they get all the wraparound services that they need. So that's been no small feat and an amazing collaboration of our healthcare entities in Bangor. The one last thing that I will mention is, and sort of looking for your approval on, is we would like to request what's called an EIS officer. So an EIS officer is an epidemic investigative services. The federal CDC offers this EI officer program. They accept people from across the country. They're often people with advanced degrees, like doctorates in public health, or they have advanced experience in epidemiology, outbreak investigation. And people get chosen to be an EIS officer, and then they're matched with a location that puts in an application to ask for an EIS officer. We think that an EIS officer would be of great benefit here to help us really to coordinate, provide some leadership, and be a on-the-ground person with expertise in putting together the pieces around the HIV cluster to help us build a system to respond more effectively and efficiently to not just HIV, but also hepatitis C. Any location we can put in an application, whether it's a local health department, a nonprofit organization, a healthcare system, or the state CDC. We feel as though we have a really good case for requesting one. An EIS officer comes to the location for 2 years, and it is all the cost for that person is incurred by the federal CDC. The only sort of cost that we're required to give is supervision. So it would just be sort of my time and some collaborative partners' time in overseeing the person's work. And honestly, with all the time and effort that I'm putting into this cluster right now, it would be a cost benefit to the city to be able to allow some of my time to be shifted to a person if we were accepted as a site. I've provided a little bit of information here in the memo. You can Google CDC EIS officer to get more information. So that's probably the one piece that kind of looking for your support for actually putting in the application. The application portal opens on Wednesday. I believe it's open for about 3 or 4 weeks.
Councilor Turnbull?
Yeah, on that point, I don't know why we wouldn't. It seems to make perfect sense. But back to the cluster, so there's 14 or 15.
14.
So are those either all of them or the vast majority that they're unhoused, and are they from the encampment or just all over the?
Great question. So the reason why it's called a cluster is because there's a commonality to the people who've been newly infected, and that commonality is the encampment.
Mhm.
So whether they've lived in the encampment or they had spent time in the encampment, maybe partaked in injection drug use in the encampment, that is right now the thing that connects them all in terms of an exposure.
And is that unique to Bangor or any other places with experiencing
It is.
HIV clusters like this? Or?
Very unique
Yeah.
to Bangor when we look at the state of Maine. The state of Maine, HIV cases, a cluster of injection drug use has not been a part of Maine's history in the past.
Right, right.
It's not to say that it's not happening in other places, because what we know is that it all depends upon testing. It all depends upon, if you look, sometimes you'll find. So could it be happening in other parts of the state? There is a potential. And that's actually one of the things that I've sort of had conversations with state CDC about, is like, could this lesson be learned for other parts of the state? And in terms of your question around, are people in the cluster experiencing homelessness? Of the 14, there are a couple people who are not. What we know is that homeless is a state that can fluctuate. And so there are some people who are housed, there are some people who aren't
But
housed.
encampment's the common,
It's common, they may not be there right now.
right, but at some point. there
At
was
some point, there was a connection to the
Yeah.
encampment.
Right.
Council Fournier, you have a question?
So this EIS officer would be more or less building something from nothing? And then at the end of that 2-year period, are we gonna have a gap to fill?
No, so what my hope is right now, what we are doing is we're putting a lot of Band-Aids on things. We are doing the best that we can to cobble together a collaborative of partners, but we're not doing a great job of building long-term solutions, only because we're still kind of in crisis mode. This EIS officer would help us build the systems
Okay. that's
that when
what I-
they walk away in 2 years, we're in a really good place.
Good. All right.
Any other questions? Council Fish?
I commend you on your hard work and efforts on collaboration, because I think, from even previously and what encounters I've had through family having issues with substance abuse or mental illness, it's just, it's very chaotic and hard to know what agencies are helping, and you have state, local nonprofits, and so I think the collaboration in trying to assess who's working and who we as a city can work with,
Yes.
and who's contributing, where hopefully we don't have a solution yet, but it sounds like we're on the right track. And also, it's probably too early yet, but as we go down this road of continuing to try to establish these relationships, it would be interesting to know what your opinion is of these 35 to 40, if you add them all up. Which ones are really being resourceful and doing, making the efforts on their mission statements, doing what they're supposed to be doing, and which ones are not, so that we can just kind of tread through and determine and recognize which ones could be more effective. And maybe we as a city, you can come to us on occasion and make recommendations of how we might be able to massage and nurture those relationships. And maybe try to make our efforts so they don't overlap one another and duplicate each other. But thank you. Every time you come in and give a report, I get more excited about it's slow, I know, but I think we're making progress.
I
So
think
thank
we
you.
are. I really think we are. And I appreciate everything that you've said. One of the things that we've tried really hard at Bangor Public Health is, as we go into these collaborative efforts, do a really good job of role definition, so that we're not duplicating, that we're learning how to work together, not against each other, and really to define our roles in the system so we can be effective and efficient. It's a process, but yeah, I appreciate your comments.
Council Levy, do you have a question?
Yes, if I had a few, I'll just go in order.
Sure.
Accreditation and workforce development. I guess before I start, if we were to look at a single employee from in the Health and Human Services Department, and we were to compare that to, in the indirect expenses, how much money is saved by mitigating the amount of people that are on the poverty spectrum going to emergency services through an employee through the city instead? Like, it's okay if you don't have a number for
That's a
that.
big question. Yeah, that's, it's the $1 million question in public health. Like, how do you measure the cost benefit of prevention?
If I can interrupt, I'm so
go ahead.
sorry. The reason why I ask that is because Scott Hardy over from, Fresh Start actually just gave all the counselors, a study from, this group called was it Fletcher Group? Is it? Yeah, okay. And I have not delved into that, study myself. I can only take it at face value, but the face value is for every dollar that we give to this, poverty spectrum fighting entity, that $1 is equivalent to like $45 basically. And so, what I'm trying to get at is, if we were to say, and by the way, jumping ahead, I completely support an EIS officer and like that should be a no-brainer. But in addition to, that officer, how much would, say, if we were to hire more, let's just call them city ambassadors, kind of similar to what, Street Plus is doing right now. Would more additional hires of city ambassadors to do, say, more monotonous work help out a lot with the specialists that work in, human health services? Because to your point earlier, I would rather have people that have years of experience in the field, thinking, as opposed to doing, the actual grunt work on the ground, which is important. We need those people there, but, I fear that, to use an analogy, a lot of people in tech that have degrees in networking constantly get told to travel hours away just to flip a switch, basically. How often does that happen in, health and human services, where we effectively have people with years of experience doing the equivalent of flipping a switch, basically?
Ooh. When I look at other models of local health departments, that's what I have to compare, like where where staff are able to spend time in their expertise versus sometimes the administrative, those other pieces that don't take the same level of expertise. When I look at other models that are out there, there's definitely places, within our public health department that we could think about, a little bit of growth could actually move some tasks to a position which would free up some time in another position, right? I've also worked in public health for a really long time. And because we're not as income driven as we like to be, we often just come in with the sort of approach of like, we just do what needs to get done. So I think your question is one that I often ask myself a lot. Like, how can I have a staff person focus on the real heavy things that need to get done that their expertise and their skill align with, and take off those other things? And I mean, the short answer is sure, we could use more staff to help with those things.
I would also, just real quick to tag on to that,
Sure.
I would just argue too that they're very heavily grant driven, and
Yes.
those grants are built out for very specific staff time and resources. So that's a future planning sort of idea, because we could be building more space and time into those grants that are, as they come back up.
Yes, that's a great point. We
Yeah.
are driven by the work plans of our
Yeah.
plan with room for flexibility.
And to cap off just on that point, and this is the main reason why I bring this up. I know you guys, I'm pointing to Chief Pelletier of the fire department. I know you and the PD spend more time than you guys really should with people that are suffering on the poverty spectrum. So having a weakened, health and human services where you're constantly doing grunt work, that forces emergency service people to also spend their extra time to deal with a problem that honestly is way too expensive for those emergency services to constantly deal with that. I mean, I bring this number up all the time. For every individual person who's experiencing somewhere near homelessness or houselessness, we're getting close to like 7 figures of the amount of money that person spends going to just the emergency room. And if we really want to talk about saving dollars for future budgets coming up in the future, I don't see how we have to be very vigilant in terms of how we look at your department and how it connects to all these other emergency services departments, because you guys should be the first people to respond to these related issues, and I want to make sure that we're not giving any more overtime than is necessary to police officers and EMS workers, firefighters, because they already have hard jobs as it is.
Yeah, I definitely appreciate you recognizing the role that public health and community services has in that bigger system.
Moving on to the opioid settlement funds, I'll just reiterate again, I do like the idea of having a opioid funds committee where whoever that committee is can designate those relationships with those individuals or those communities, and I'd be more than happy to have another discussion about that. But I completely agree with you. I hear this all the time, and I know you do, Councillor Beck, as well, regarding a lot of these different communities. But this is effectively blood money at the end of the day. That's what we received. I think it's important for us to recognize that's what these opioid settlement funds are. They're effectively blood money, and we have to give that the respect that it's due, because many people's lives were extinguished because of the greed of the Sackler family. And it's very important that we mitigate any miscommunication spending these funds as possible. And we make sure that every dollar that we spend, we get the absolute best bang for our buck.
Yeah.
And also we reflect what that community wants to use with those funds. I'll pick on Councillor Fournier. He has expressed in the past that he has experience with the opioid experience, and I commend him for sharing that multiple times. It's important for us as leaders to show that this is also affecting us as well. I would hesitate to put anyone on that committee that doesn't have any clear direct line to making decisions for the opioid settlement fund. So that's my stance on that. I didn't know if you had okay.
I just feel very grateful that the city of Bangor is putting it towards public health and community services. That's not happening across the country. And I feel very grateful that we're in an environment where that was recognized as important.
And we haven't discussed the accounting. Yeah, I'll save that for later. That's all I have.
Sorry, we'll try and move along here. We're eating up a little bit of time. Tracy Willett, Parks and Rec Director, he has a quick update on, oh, sorry.
Real fast question,
Yeah.
on the EIS officer thing, are you gonna come back to us later with something for us to actually make a motion on approve, or were you looking for some kind of motion tonight to say go ahead and apply?
I think I just needed a thumbs up tonight. Motion tonight.
Oh,
So I'll absolutely make that motion.
all right. Thank you.
Oh, wait, I can't.
Oh, wait,
I
yeah,
can't
you're
make
not on the
that motion.
committee.
Sorry.
Second.
Thank you.
I'll be brief. I think there's a background memo in your meeting materials, unless there are specific questions, certainly, excuse me, we're working on a variety of projects, both currently and hoping to wrap up. But again, unless there are specific questions of me and what we're doing, I'll keep it brief.
You're pretty much always busy doing something.
We try to stay busy. I think we're doing all right at it.
Is there any specific questions for Director Willett?
Appreciate that. Thank you.
All right. Moving right along. Legal did give a quick update. The city attorney is in the room, but I'm just gonna kind of give a couple of touches, and if you have specific questions, I'm sure you can come to the table. But they are looking to commence court actions against a number of property owners who have failed to register their vacant residential buildings. And they are also in the early stages of prosecuting land use ordinance violation enforcement against the owners of the Bangor Mall in district court. And they are also working with the airport very closely on complex solicitation documentation, as well as compliance with FAA regulations applicable to federally funded airport construction projects. There's more there, but I think that those are kind of the big things. So if there's no questions, I'll keep moving.
Are there specific questions? I mean, Attorney Sobchak has talked to us about all of those at one point or another and was fairly comprehensive, so.
Yeah.
Anything come to mind right now?
Great.
Onward.
And we can certainly follow up or circle up in a future meeting as well if there are additional questions. I also have an update from police. I actually let them know they did not need to attend this meeting because I kind of anticipated that this would move or take up a lot of time. But again, if follow-up's necessary, we can certainly do that. So they are in the process of implementing their community enforcement team now that they are close to fully staffed. They're able to bring this team back and they cover issues such as neighborhood struggles, traffic enforcement, school zone presence, downtown issues, and more. So that's a great thing. They're also enhancing their main drug enforcement agency partnership by adding an additional member to investigate or expand their illegal drug sales investigations in Bangor. So I would say that's also a positive thing. Moving right along, they're also continuing a partnership with Bangor Fire Department on a capital project of upgrading the radio infrastructure that benefits both sides, more PD, I've been told, but in general, I've heard that that is actually going really well, and they've already seen an improvement in those radio communications. And then last, they are bringing back their rape aggression defense, or called RAD program, that provides self-awareness and defense training for women.
Council Forney.
So why did we back off on Red?
I think it was a staffing issue.
It was a staff.
Yes, in fact, I think a lot of these we were able to move forward with because their staffing
All right.
levels, I think on paper, they're only down one.
That's
First time in a long time that's happened, so positive progress, I would say. With fire department, Deputy Chief Pelletier is in the room, so if I get anything wrong, he can come correct me. So there are renovations at Central Fire Station, including repair to the apparatus bay floor and drains, remodel, update of bunk rooms and bathrooms. They're replacing plumbing and other work at Central Fire. They're also looking to replace in-house breathing air compressor and fill station at Central Fire that's currently out to bid. They, of course, the voters approved the bond for new and improved training center. So be moving forward with design and putting that out as well, I assume, as well as permitting, hopefully to begin next year. They're also partnering with United Training Center for instructors to offer an advanced EMT classes at Central Fire, which is great news. And an ambulance remount is in progress and expected to be back in service in February. And of course, they continue to seek out ways to recruit and retain qualified personnel. And I want to give a personal shout out to the crews today, who are very helpful in our process for the fire chief interview process today. They were very accommodating, and thank you very much for that. Anything I missed? He's the one that gave me the information, so I hope not. All right, moving right along, unless there's no questions. Okay, great. Oh,
I just had one question, for you, Chief. So, with, current morale as it is right now, in the, department, how are, the recruitment and retention basically going right now?
So we're currently down 9 positions. We are still working out different ways to attract new people. We're hopeful to do another hiring process in the near future. And I think morale is at a pretty good level right now, and something that we're still working on, identifying ways that we can continue to improve that, so.
Okay. Any other additional comments you'd like to give?
No, just appreciate the opportunity to speak, so thank you.
Thank you, Chief.
Thanks. Okay,
all right, we're closing in. So the community connector, I provided some helpful information and background for this, but just really quick, for those that may not know, community connector consists of 2 parts, both fixed route and ADA paratransit services. The system actually started back in the 70s. We service multiple towns, and we are a direct recipient of federal funding that of course comes with a lot of responsibilities. So some projects that are currently in progress for the community connector are, we continue to implement that technology package, including a rider app, which was did see a soft release, so we could work through some bugs on the background, but we will actually be sending out a press release, I believe, this week. Launching that to, encouraging riders to download that up and take advantage of it. In January, we will also have fully implemented the fixed stop system across all routes. That ties back to that recommendation, in the study back in 2019 to improve efficiency and reliability of the system. So we've been in a 6-month transition period, and come January 1, it will be a fully fixed stop system, which means in order to get on and off the bus, you need to be at a designated bus stop. The app will help with that because it will show folks where the nearest bus stop is to them. And of course, the Community Connector also has kind of its own web page within the city's web page. And you may have noticed that Cody, he's so clever, he figured out a way to embed in real time where you can see the buses are right on their homepage of the Community Connector website. So that is really cool. And also we are moving forward with the Cold Bus Barn rehabilitation. As you all know, that went out to bid. We selected an architect. We did have a kickoff meeting that included DOT and FTA, along with a number of city departments, as that building has historically been used by Public Works, Fleet, Sewer, and Community Connector. So we wanted to make sure everybody was on board in terms of us determining the best use of that building moving forward. But of course, the main goals are to rehabilitate it so there's no more leaking, to electrify it, and to build in some workforce training and development in terms of a training space and restrooms and things of that nature. And we continue to evaluate staffing levels as well as internal structure. We did learn that we did get that grant that we applied for from the state to put on both train the trainer for CDL, which is greatly needed because we lack trainers to actually put those classes on, but to also hold some classes ourselves for drivers to get their CDL. And then, of course, their passenger endorsement. And that could include other departments too, if there was a need there. But traditionally, we've done it once before in Community Connector, but it was really difficult to manage in-house because we had limited trainers and we need them on the road driving. So to reallocate those resources has been a little bit of a struggle, but this grant should actually help reduce that burden and hopefully bring our numbers back up to numbers that I will say with hopeful attitude will help us bring back Saturday service sooner rather than later. These funds actually have to be used by the end of June. So this is a quick turnaround. We expect that we should have a class on hopefully by February and folks licensed hopefully by like March, April, if all goes well. So I will definitely bring back a future update and how that goes. And in fact, the last time when we did that in-house CDL class, that is actually what bolstered our numbers to bring back Saturday service the last time we lost it. So we hope that by doing the two pieces that will also bolster training numbers that will help us to do ongoing classes in the long term, but also get us a nice full class of CDL drivers seeking to drive transit buses around Bangor for us, or in the greater Bangor area, I should say. And then, of course, we continue to work with the union as well in seeking out ways to better the system and our drivers. And one thing that's on our radar too is in the coming years, hopefully sooner rather than later, once some of these projects wrap up and free up some staff time, we understand that there is a need to foster relationships with businesses and organizations to help increase ridership, especially now that we'll have the technology implemented for better rider counter. And so in other pieces that really hopefully add to the value of riding the system as a whole. Other than that, if there's no questions, again, I put some additional information in there just for everybody to be able to read through if they were curious. I'm happy to answer any questions, or I can move on. Yeah, okay. The last one I wanted to provide some information on, and there's multiple pages, so I'm not going to cover it all, but I just wanted to give kind of an overview of human resources. So in addition to being the assistant city manager, I'm also the HR director and lead negotiator for the city for our collective bargaining units. So we have 14 unions, over 600 employees across 12 departments, plus non-union. Excuse me, and that's included in the 600 number. And I have 2 full-time human resources officers that currently have divided all the departments, and they provide support such as conflict resolution, benefit administration, grievances, leave requests, orientation, recruitment, training. They do a lot. And we are seeking to hire a third that will be dedicated to the airport specifically. And of course, next year I will have 7 collective bargaining agreements that will be up. So I will need to renegotiate all of those in addition to reopeners related to the Paid Family Medical Leave Act as well. So next year is going to be very busy. Just a quick reminder that even if you're not covered under a collective bargaining agreement, municipal employees have more protections than your average main sort of worker that works for like the private sector, for example. So if you're a municipal employee, per state law, you have due process rights and what's called a property interest to your job, which means that if, with very limited exceptions, we cannot just fire you at will. We have to go through a process and prove for cause why you were terminated. In addition to that, we have been making some progress in terms of trying to create a better work-life balance and flexible work environment to the degree possible while balancing the needs of our citizens. So recent measures include updating our vacation accruals, also allowing for more flexible use of accrued leave time, such as sick leave for family or self purposes, as well as modifying some work schedules to be more attractive in the areas where that's possible. That work is ongoing, as you might imagine, especially with all those collective bargaining agreements. There's often a lot of considerations that we need to go through to make sure that we're not inadvertently or unilaterally making decisions that go against either policy or contract. Lastly, some additional projects or ongoing projects for HR specifically include an internal intranet. And basically what that is a back end that city employees can log into on our current website, and they will be able to find sort of a cache of all sorts of pertinent information to them as an employee. So whether that's benefit information or policy, that information will be readily available. I will say that this is separate from our Human Resources Information System, or HRIS. That system was previously approved, however, it came in higher than budgeted. So we did not move forward with that as we continue to seek out additional ways to cover the additional costs. The internet, in my opinion, is kind of a stopgap to HRIS because HRIS is much more user-friendly and also functional in a way the internet is not. So HRIS, you could actually go in and change your benefit information as opposed to just looking at a PDF, for example, that has benefit information on it. So they are different, but the internet will at least provide sort of that easy to access portal for employees in the meantime to easily access some quick and easy information that they may be searching for that right now they might have to reach out to HROs for. So that is good news. We have also stepped up and made good progress in our recruitment efforts through targeted advertising within specialized fields. As well as our social media presence and utilizing like professional resources such as LinkedIn. We continue to chip away at updating the full personnel rules and regs, which is more than 10 years old. So that is a big need to overhaul in general, but it is a little slow going just given the resources that we have at the moment. And then, of course, paired with that is that paid family medical leave law that I referenced earlier. We start to pay into that system in January, but it won't actually roll out for use until the following year. However, we have to part of that law is that if within a certain window, if your collective bargaining agreement was up, you had to negotiate over it. But nobody knew the rules or what that would look like, so there are placeholders in all the contracts, for example, this year, that say that I'll reopen it once we can, which is likely to be next year, to, and then bargain over those terms. And then, of course, moving forward, I will do that with all of them as they open. Lastly, you know, we do our best to improve communication, reduce turnover, offer trainings, address compression, and other ways to better support our workforce. I know that folks are really tired of hearing about vacancies and maybe turnover and the pandemic and how that impacted our workforce. But unfortunately, there's no way we can talk about personnel without talking about those factors. It's just the way it is. And I'm not going to go through it all, but I did provide several pages worth of information with sources that kind of provide that better, bigger picture, if you will, in terms of all the pressures that the city has faced as it relates to vacancies and turnover. We are not alone. That is any conference I attend, any website I look at, all of these sources show that, in particular, there was one government software company called NeoGov that actually we use through Maine Municipal. In 2023, they reported that, quote, over the past 1 to 2 years, the public sector has faced a hiring crisis and unprecedented employee turnover, end quote. And I have to say that while we have been pivoting and doing our best to improve the stance of the city and to recruit and retrain, there's no quick, easy bullet that fixes it overnight. And honestly, like once we got over like one big milestone, such as increasing vacation accruals in order to be more competitive in our area, of course, we're on to the next thing because we know that that one thing is not going to be enough in the long term. So it is an ongoing effort that I think we continue to make good strides in. I don't want to lose sight of that. For example, I know that for more than a decade, the police department was down 7, 8, 9, 10, 12 employees. And I think we're down to just 1. And other areas such as fire services, they're seeing unprecedented issues themselves in terms of a much lower applicant pool and things of that nature. So anything that we're doing to react to that is not going to be immediate, but it is certainly something that we are actively working on. And as you'll see in the information I provided in the memo, you know, it's not uncommon. It's the pandemic, but it's also our state and the lack of workers that are readily available. It's the older generation, you know, retiring out in droves, and our population being the oldest state in the United States. Like all of those have pressures that when you are living day to day, you may not understand that sort of bigger picture. But it's my job to kind of keep that in mind, especially as I go through negotiations and other factors like that. And just to be fair, we have made some pretty good market adjustments, especially with the recent contracts that we've gone through, as you all are aware. But we're not done yet. There are contracts that we have not touched since early pandemic. And so those are going to need to come into market as well, same as the other ones. So we have more work to do. We certainly understand that. But with that said, we are trying to always keep in mind the taxpayer and how to balance those overall needs, because when you have 12 departments and over 600 employees, if you give this group over here something without understanding how that impacts overall, I wouldn't be properly doing my job, because it will have impacts and effects in other ways that may not be immediately known, but will certainly or could potentially put the city in an awkward position down the road if Debbie and I are not trying to keep in mind that bigger picture across all of our departments and divisions across the city. So I apologize, that was pretty long-winded. I hope everybody gets a chance to read that memo, and I'm happy to answer any questions.
I don't see any questions. However, some of these departments should be coming before us on a quarterly basis instead of once a year.
Okay.
because I think we miss things by not having contact with them and being able to talk about smaller chunks of what's going on as opposed to a big rendition of we're doing this, we're doing this, we're doing this, we're doing this. So, and we can talk about that, but
Yeah, I can certainly add that as an ongoing, maybe a quarterly thing, an overview of those projects that are in progress for all these departments that come through GovOps. Yep,
it'll work.
great.
Council Leonard.
So, I just had really one thing, and that's about, hiring, retention. I definitely think, and I completely understand where you're coming from. There's only so much that we can offer for a budget. There's only so much that we can do depending on the services. Completely understand that. With that said, we still have services that we have to provide for the citizens. And I think now more than ever, especially considering the new labor force, the younger labor force that's coming in, they have a different type of a work-life balance that we really need to respect if we want to get that younger labor force here. And one way, I'll use a very niche example. I don't know if state law here in Maine would be against this, so someone please correct me if this is a bad example, but I know in Illinois, they had issues regarding hiring dispatch workers for 911, and they have started to, since 2018, 2019, to have those dispatchers be able to have the option to work from home, for example, which dispatch work, which I'm sure everyone at this table knows, is constantly stretched thin. And I know the Penobscot County also has their issues there as well. And they're making some innovative moves with AI to help them out. But at the end of the day, we do need to take into consideration that if we can't necessarily give people the salary, if we can't have a competitive salary, we can at the very least be competitive with a work-life balance for some positions.
Yeah, and I definitely agree with that. That is something that we're always sort of looking at. With dispatch specifically, actually, we have again, we're down to just a couple of vacancies, which is a great improvement from just a year ago. Unfortunately, the issue with work from home is you know, in public service, you know, because there's so many of our departments that require sort of the direct face-to-face sort of service, to be able to pocket, say that some areas can work from home is all well and good, but it does require additional resources because then you have to outfit that person's work station at home to be compliant and have access to network and all of those things. In addition to policies to make sure that our supervisors and managers are aware of the parameters and all that other stuff. So I think there's just, it's not something that we can do overnight. It's like a work in progress, if you will, around policies and shifts and things, but I definitely agree. I don't think it's going away. And we do in some instances, like, for example, I'll use myself as an example. I needed to be home because my dog had surgery. And I had originally planned to take the time off as vacation, but I just couldn't. So I worked from home for a few days. It was limited in duration and it was essentially like some low level accommodation. And we certainly do make accommodations for medical reasons and things as well. But it's that greater sort of broader perspective that we're always evaluating and trying to move in that direction. Yeah, it's a little more difficult than I would have imagined.
Oh, so certainly. And of course, that entire example I gave, it's a spectrum. I do expect most city employees or employees in general, not every position can be work from home. Most would have to be a hybrid model. Some, obviously, like some positions in the police department. I don't expect many police officers to work from home, for example. I would support it if it was possible. But I just use that as one example. There are a multitude of ways that we can make ourselves more lucrative to workers to come here. And we don't have to talk about this right now. I know that we've already had a lot of discussions over a multitude of things this evening, but I think this is a grander strategy that we're really going to have to spend more time on, because like you said, we're not gonna be able to solve this overnight. We're gonna have to figure out what assets or what opportunities or what things we can offer besides larger increased salaries that can be more attractive to the area. We have to be very creative about this stuff, because I get, and I do appreciate you making it very clear to us, just we're not the only ones experiencing these employment issues. That doesn't cancel out the fact that we still need to hire people.
No, I would definitely agree. And again, though we are making progress in that area, and unfortunately with personnel rules and regs that cover like basically essentially all the rules that govern personnel, with the exception of what the collective bargaining agreements cover specifically, those being so outdated, it really kind of prevents us from moving forward in certain ways. So that's just what I mean in terms of needing to catch up, play catch up in a lot of ways, but sort of those, I think, more flexible policies should allow for more flexibility in moving in that direction. Yeah. All right, sorry, that was a long first item.
I'm so sorry. I actually had one thing I wanted to bring up on the community connector. It's just super quick.
Okay.
So it's about, like, I appreciate everything you said about building relationships with businesses and other organizations, especially to promote it more. I'm increasingly becoming more and more against the idea. If we're trying to get more and more people to use the community connector, I'm increasingly becoming against the idea of even having a fair at this point in time. Are there but basically I'm just asking you or anyone at this table, like, is there something I'm missing regarding do we have to have some sort of fair for some reason that I'm just not seeing? Because when I look at it from just a profit standpoint, we're never gonna make a profit off of that. It's just no reason to even consider trying to make a profit off of that. And I know that there was a conversation that we were having about reducing the fare overall, but if the idea is to increase ridership, what are there any negative ramifications to just axing the fare altogether?
I think it just comes down to what the taxpayers want to pick up, right? Because right now we budget, I think, somewhere between 150 to 200,000 in fare revenue. And the idea is it's been stagnant at $1.50 per ride for a long time. And because we didn't want to increase that if we weren't adding value to the service. And so a part of that with the technology and the new transit center and stuff was to actually work with BACS, Bangor Area Comprehensive Transportation System, to actually do a fare study. And that should objectively kind of tell us, like, market wise, and in comparison and all those sorts of factors, like where we lie and what's recommended. Now, of course, the council could decide to supplement those fares and just spread it out per the formula across the municipalities, of which I think Bangor is just over 60% of the local share. But so that's a future conversation, hopefully when we have that study with more information.
Thank you.
Yeah.
Okay. We have an ordinance.
Yes, this is around polystyrene, and I believe Dave Sebchek, city attorney, is here to provide a quick overview of this item for your consideration.
Hello. So the ordinance amendment is a narrow kind of a thing, so I'll try to proceed quickly. So polystyrene foam, as you probably know, is a petroleum-based lightweight plastic material, sometimes used as food service ware by retail food vendors. It is a common pollutant that fragments into smaller non-biodegradable pieces that can be ingested by marine life and other wildlife and can harm or kill them. And when we passed our polystyrene ordinance, disposable food containers made from polystyrene foam constituted a portion of the litter in Bangor streets, parks, and public places. And the city's goal was to replace polystyrene foam food containers with reusable, recyclable, or combustible alternatives. And the polystyrene ordinance prohibited food establishments from processing, preparing, or selling, or providing food or beverages in or on a disposable food container that is composed in whole or in part of polystyrene foam, with certain exemptions. The ordinance became effective January 1st, 2020. And then shortly thereafter, there was an emergency type situation regarding the supply chain. And the enforcement part of it, there was a problem in that certain places, for example, the hospital, they couldn't get alternatives because of the supply chain problem. So what we did was a temporary solution at the time. We made the enforcement more discretionary on the part of the city manager. We changed a couple of shalls to mays, and we did not intend that flexibility in the enforcement to be a permanent solution, but rather a temporary solution. So what we've done now is try to craft a more permanent solution in terms of the enforcement by proposing an amendment to the exemption part of the ordinance and the enforcement part of the ordinance that would allow an exemption for an unreasonable difficulty. And it's defined in the proposed amended ordinance. It's defined as an unwarranted impediment in locating a substitute product. The unreasonable difficulty would include, but it isn't limited to, when a business is unable to acquire a substitute product due to unusual delays in the supply chain or other situations where an alternative to polystyrene containers or trays can't be secured by the food establishment. We would then change back one of the mays in the enforcement by the city manager to a shall again. So we'd have this objective test that would be inserted into the exemption section of the polystyrene ordinance to make it a more objective type of enforcement and reduce the amount of discretion that the city manager had during that temporary period.
So you need approval, a vote to recommend this to council. Are you talking about the next council meeting?
Yes. And if you have any questions.
If there's no questions.
I just have one question. So you're talking about an objective test. I guess how is the test objective that we have here in the ordinance that we're changing?
Well, if somebody wants to try to comply with that exemption, they would need to submit. They would need to submit a written request for a waiver to the city manager that explains why compliance with the ban would pose an unreasonable difficulty. And then the unreasonable difficulty exemption would be the objective test that was used up until this point in time. The city manager, it said the city manager may enforce or may send a letter ordering them to comply. But that may would be changed back to a shall. But if they can show objectively that they have this unreasonable difficulty exemption situation, then they would be able to get up to 1 year exemption from it and could apply for another year.
Okay, I just, the reason I'm asking it, because it sounds more like it's up to the city manager discretion whether or not they truly can afford it. For example, if the business says, hey, this company I'm using, jacking my price up 40% on this material, can't afford that, tries to find other vendors, comes forward, finds one that's a little less, but still more. Business owner says, I can't afford this, but ultimately it's the city manager discretion whether or not that person. I guess I'm trying to find what the objective part of this, other than them just saying, I can't afford this.
The objective part of it would be that the city manager would be bound to apply the test that's in the new ordinance provision.
Okay.
Whereas at this point in time, the city manager could just say, we're not gonna enforce it in this situation.
Gotcha.
Because the way the enforcement was worded.
Okay, so it's the test itself is another part of the ordinance. Okay, I just didn't have that here.
Well, the test is in the it would be in, new section 217(4)D. It would be added and the language is there, right there.
All right, well, right, I just, but everything in there is subjective, is what I'm saying, it's not objective. Like there's no saying what the threshold is or anything like that, it just, you can just come forward, write your essay and say, hey, here's my problem. And then it's up to the city manager to look it over and say, yeah, this looks good, I'll go ahead and give you that waiver or not. I just, either it's objective or it's not, it doesn't feel objective.
Well, the city manager would be bound by complying with the objective test that's set forth in the new provision. Currently, the amount of subjectivity would be far greater than after the change. I don't know if anything is completely objective, but it's a lot more objective. It's as objective as we could come up with this change.
Sure. Okay, thank you.
Counselor Dean.
I think the change is perfectly reasonable because the intention is to eliminate the containers. So to make it just a little bit more difficult, or for having someone have to make more of a statement as to why they're using them, seems reasonable to me.
Other questions, comments? We'll need a motion.
I'll make a motion.
Second.
It's been moved and seconded that this
Sorry,
recommend.
Counselor Fish is not on the committee.
Sorry.
Oh,
I'm
no, you're
tired.
not. You just got so wrapped up in the discussion, you couldn't help yourself. Do we have a second from a committee member? Councilor Mallow has his hand up.
I think you're, oh. There we go.
I'll second the motion.
It's been moved and seconded that the ordinance change will be recommended for approval to full council. There. All right. Next, we have an order amending the liquor license processing policy.
Yes, this is City Clerk Goodwin.
Oh, you're back.
They're back. So the main Bureau of Alcoholic Beverages and Lottery Operations, BABLO is what we call them. They have changed their licensing processes. And the businesses now have to apply electronically online for their liquor license. And the state is trying to reduce their paperwork and to reduce the time that there's a lot of businesses that file late, so that they have to have extensions and it causes issues with liquor deliveries and all of those things. So they changed their process, and so it now goes to the state before it comes to the city. So once they get it electronically, they send it to me, and then we send it out to the departments for approval. We now have to sign off electronically, so you know, at the council meetings, you sign off on those forms after we get all of the approvals. This would just allow me to sign off rather than bringing the paperwork to you to do. And if there is an issue with a liquor license, that will come back to you under new business. We won't approve it if there's a problem.
How sad, we don't have to shuffle those papers down. Questions, comments? Sounds like we're more efficient.
Yes, very much. And it'll reduce our paperwork and our storage of records, which we're trying to do too.
Yes. Comments? Questions? We need a motion to recommend approval to council.
I'll make a motion to recommend approval of council.
I'll second.
Okay, it's been moved and seconded. Is there any discussion? Seeing no objection, it will go ahead. Thank you. Sign away. Amending the policy for naming of city-owned properties.
Yes. So I actually think that Ms. Leanna Fellis and Katie Bryden are here from the Advisory Committee on Racial Equity, Inclusion and Human Rights. They're gonna join the table, I think. I apologize, I did outline a memo, just providing an overview of the recommended changes, but unfortunately, that was inadvertently omitted But just to highlight a few, the updates would clarify that the policy does not apply to properties that are subject to naming rights agreements. It would provide an acknowledgement meant to honor that the land we are located on is the traditional territory of the Wabanaki Confederacy, the people of the Dawnland, and specifically Penobscot Nation. It would add language that speaks to traditionally underrepresented communities and minorities as a category for consideration when naming properties. It would amend the process to include referrals to the advisory committee with an educational component when appropriate. And it would add language and to the process to review to review established names of monuments and markers that may have a negative connotation or is inconsistent with values and characteristics of the city. This was recommended for approval at the ICR committee in October. Would you either of you like to share anything or add to that?
I think you covered it very well. Thank you so much.
That was brilliant.
Yeah.
Great work.
You know, there have been a couple of times that informally our committee has been asked to look at naming of different areas. We saw this as a wonderful opportunity in reviewing this policy to really formalize the committee here in Bangor and offer us as a resource in connection with the Bangor Historical Society and hopefully future partnerships with the Wabanaki to really put forth thoughtful recommendations and really, you know, it goes to what Courtney just said in our ordinance here is, you know, be mindful of where our city is, who we live within our community, and really, you know, when people come here, what we want to represent to everyone who's living here and visiting.
And I believe the one piece of that ordinance that will not be changing, I don't think that you said this, is that if things are named because of a major donation or funding, then our group will not be involved in making any changes for that. Obviously, that won't come into play. But if it is a city-owned property that we're considering naming, we have been able to create a lot of great partnerships this year, and we look forward to continuing to work with all of you so that the names are really reflective and obviously here to stay. We're not one of those cities that we have to change out all of our statues and names anytime soon.
Questions, comments? A motion, because this will also have to go to the full council.
So moved.
Second. Was that you?
Yes.
Oh, okay. I just wanted to make sure it wasn't
You want
Carol.
Carolyn again?
It has been moved. It has been moved and seconded that this will go to full council for amending the policy for naming of the city-owned properties based on the committee's recommendation. And seeing no objections, it's gone.
Wonderful. Thank you. Thanks,
Thank
all.
you both very
Yeah.
much.
Of course.
That was actually delightful. I wasn't expecting that.
Our next item is the MRC board member vote.
Yes, so you'll see a memo in your packet along with a voting ballot. We have the opportunity to cast a ballot for one individual only to sit on the municipal review committee, commonly referred to as MRC. Staff's recommendation is to basically reappoint Aaron Hootery, our public works director, to this committee. He has served since Kathy Conlow, our former manager, retired back in 2021. So he's very knowledgeable and he does a great job in staff's opinion of representing Bangor's interests on this very important committee. In which case Bangor, I think, is the largest contributor to MRC. So we think it's really important that we have representation on the board. And so my recommendation would be to allow staff to cast the ballot or the vote for Aaron Hootery on the ballot.
Only question I had was, Aaron okay with this?
Yes.
Okay.
And in fact, actually, thank you for mentioning that, because I did want to say he would have been here tonight, but he had an opportunity to participate in a student,
Okay.
oh, I'm forgetting the word, but it was something lovely for children. So I was like, no, go to that and we'll do this. So.
I mean, I'm not on the committee, but I have no objection with that.
Okay, we need a motion. We're gonna vote.
So moved.
Second. Okay, it's been moved and seconded to have staff cast the vote for Aaron Hootery for the Board of Directors of MRC.
Perfect. Thank you very much.
Next, we going right in order?
Yep.
Okay, we have a Cleveland Street encampment closure update.
Yes, so our homelessness response manager was unable to attend tonight, so I believe Jen Gunderman and Debbie Laurie are going to join us to provide an update on this closure.
My vehicle with energy statements.
So, I believe Jen included a fairly robust memo on the update of the work up through last Tuesday that continues to take place within the encampment located in the area of Cleveland Street. Of course, that's the one thing I didn't print out, but how's that for? To the point, we continue to make good progress, bringing together community partners, making sure that we're doing a better job connecting with the neighbors in the area. I know Councilor Beck had some questions based on some conversations he's had with folks. So for example, today, there's a case management organization that is actually today hosted its second on-site luncheon and meet and greet to try to create an easier handoff between the case workers and the navigators who are out there and the outreach workers who are out there so that they can hand folks off to case management, because we know a number of folks really need those additional supports to be successful. The path and outreach workers share that there does seem to be a sense of at least hope again, that people feel that there is energy and synergy behind the work that's being done. I think Jen Gunderman continues to work with the healthcare providers to find out what the mechanism looks like as to how we can ensure that anybody who is currently obtaining healthcare services in that setting will continue to be connected to healthcare services and how they are. So for those of you that don't know, for example, there is medical outreach that goes into the encampment at least once a week, if not more. And those things can include wound care, medication needs, general illnesses, whatever that may be. Wound care seems to be one of the bigger ones that I know that the physician, the medical services team works on. So I think we have not dropped off any partners at this point. We've pivoted our housing subgroup that was working a little bit. We have staff on our community development staff who is working with the quality housing program providers. And so she already had relationships with a number of landlords. So we're utilizing her to help sort of streamline access to housing units. We've gotten some folks into shelter that I can tell you that people never thought would actually enter into shelter. So those were big wins. I didn't hear if they made it all weekend or not, but I believe they did. We continue, I think in her list, in her memo, she had identified how many people have been housed, how many people have access to housing assistance, how many people have entered shelter or chosen another, or are currently located in another location. It could be reunification, it could be incarceration, it could be, we know we have one person who we actually got to move into a warming center. That was a big win for that particular person who was unwilling and felt unable to access services. I can tell you that earlier today, they actually got a couple of other folks who had a lease signing today. So good progress continues to be made. It is difficult work. People are, those who are providing the services is a big shout out to the direct service teams who've been working diligently to spend more and more time in the encampment to ensure everyone is aware of the services available, understand how each service supports them in their journey to housing, We talked about the case management, folks that have been on site. That second one was today. We've talked about the housing, the two folks who had their, lease up today. One of those people is an individual, that we weren't able to successfully house off Valley Avenue. So that and that person engaged in some behavior that was not really beneficial to them becoming housed, and that really has turned a big corner. So, that's really a great thing. We are seeing more self-solve through avenues like couch surfing. Though day visiting does seem to have slowed down. So a lot of times during the day, you see a number of folks, additional folks who may not actually be living on site to be there during the day. It's really difficult for us to determine what the overnight count is. Residents indicate there's 50 or 55 actively living there. We are continuing to struggle with new individuals showing up. So we're gonna give folks one last shot to say, you gotta be working with either the path team or the home team. And if not, here's another resource that you can call if you need to make other arrangements, because you can't stay here after January 3rd. Next week, they're actually facilitating a pet clinic. We know a number of folks have furry friends, and we know that sometimes a barrier to housing is up-to-date vaccinations. So we're getting that taken care of next week. The one complicating factor I'm gonna say right now is folks continuing to move in. We're really working to balance the need to ensure every person who is unsheltered in a community has access to services and supports. But also trying to really stick to our by name list so that we can work to close this area. I think the relationships that everyone has built, that Jenna has shepherded, are really going to serve us well and be able to pivot to warming centers after. If we can get through and work to bring everybody together and to streamline and align the process within this area, I think we're going to then be able to move on to other spots in the city. Speaking of the warming centers, what we're actually working with is a couple of the warming centers to gather certain information. Each one kind of gathered input on individuals who came to utilize services very differently, and we're trying to standardize that. Not everybody was overly embracing, but they're going to give it a whirl. So continuing to get the community moving as one will be really helpful. We continue to look for even folks, so shelters who have perhaps banned somebody for behaviors in the past, we've gone back to them and said, will you consider, A, B, or C? And they're all willing to relook at all of those bans that have happened in the past, so that nobody is without a option as to what could be a different choice. So I don't know, Jen, if you wanted to add.
Just 2 seconds to add. One, I just want to highlight that the medical outreach that's happening is not public health that's doing it. It's PCHC, Amy's West team that's been going up, and family planning now has a mobile van, and that it's more than a van. It's like they need a CDL driver to drive it. It was actually in the encampment last week, being able to bring people on to the rig and provide a clinic setting for people. I think from public health's perspective, we're also trying to keep an eye on those things that the research indicates to us that can happen after an encampment is closed, whether it's an increase in overdoses, increase in some other public health concerning issues, talking with partners, talking with federal partners on how to implement the 19 strategies, and really making sure that we're doing this as mindfully as possible, and then providing the support to either get people ready, making sure they've got their documents, making sure they have a list of resources. Jen is making sure that they've got a place to store their belongings, to what are the material things that people might need as they move on, to make sure they have naloxone, make sure they have a wound care kit, make sure they have a resource list. So we really are, with Jenna's guidance, trying, and a lot of community partners, figure out that A to Z, to make sure that people are not just put in a house, but have that support. So yeah, that was just a few minutes.
Council Pelletier, you had a question?
Thank you. Where are we with the Country Inn?
I sent that email again today. and said, where are you with the timeline? The last I'd heard is they anticipated, pending what a contractor has to say, that they'll be, that they should be done by the end of the year. And I said, where are your lease up and tenancy documents? We're working on them. Okay, where are they? Time's a ticking.
Council Fish?
Of the 50 residents still in the encampment, do you have a guess of what percentage are making an effort incorporating, what percentage are not?
I would say on the by name list, most people are engaging. That's sort of how they're on the by name list is because they've been talking with path outreach workers. They've been trying to figure out what their best path is. So I don't have an exact number, but
I would guess it's about two. If you may remember the first time we did sort of green, yellow and red. And I think if you remember, the greens were like 1/3 of the total. And the yellows were sort of a third, and then the reds were sort of a third. And I would say that the reds are likely at a half or less. So I don't think some folks are gonna dig in. But our hope is every time we get somebody housed, every time they see someone making movement, we do have some folks who were not engaging at all and who have flipped over into engaging partially. Because they do see the change and they do have hope and belief. So that's been positive. So I think there's a much higher percentage of those who are engaging regularly now. And I believe it's from the sustained efforts of the direct service providers and all of the community supports that have been really focused in that area.
Do you think it's also because we have a deadline? And
It could be.
and it's
It
kind
could
of
be.
a real deadline, and that
Correct.
might give them some motivation,
Correct.
and that's encouraging. Yeah.
I agree, but I have to go back to what Jeff has seen. I've seen amazing things because there's been a consistent presence by a number of organizations who are there building really compassionate relationships that people are opening up in ways that I had not seen when I first was working in that space.
That's great news. Thank you.
Council Beck?
So I guess I'm missing something with this, like I'm hearing all these great stories, which I agree, and I've heard them myself. And what I'm hearing is we're encouraging these people because we're building this relationship, we're encouraging them to want to engage and build some trust here. But then I hear the December 31st date, and that's like a guillotine that's gonna cut that right off, and we're gonna have to start all the way over, whether we're helping them at Camp Hope, where we already have a relationship, or we find them downtown later, or we find them by the Burlington building, or we find them somewhere else. We're gonna have to start over again, and I'm not able to connect the two about that. Like, I feel like we're having such success with the work that's being done. Finish it there. Like, don't set this art, because we manufactured that date. So don't stick to it. Keep doing the work until we get to, because we have a list of 55 people with 4 weeks to go. We're gonna find people as they migrate, we're gonna have to start this process over somewhere in Bangor. Why not keep the relationships that we've already built and get the job done?
Council Leonard?
I also, will want to commend the work that has been done by the city, over the last year. It really is night and day compared to what was going on last year. So I do want to commend everyone for putting in a lot more effort there. And we're seeing results, like, obviously, we see the numbers as they are. I do have similar concerns that, Councilor Beck brought up, and I have concerns that this, closure date, I'll put it this way. Can we guarantee that if we close the encampment, there will be no future encampment in the future? If someone can guarantee me that right now, I'll be completely in favor of this encampment closure, but I don't think that's going to happen. I think if we close this encampment, another one's going to pop up. And I know we have an HIV cluster there. I know there are so many other issues related there. We don't want encampments. They're obviously not healthy, and they're obviously it's a black hole of humanity going to die, basically. It's But the alternative is, and I'm reminded of, school committee member, Chesler John Rowe, had someone who left the encampment after we closed it last year. And, her and a number of other people, experienced people coming from that encampment and trying to survive, trying to find shelter in some way. I would be more comfortable suspending the current date that we have and giving these individuals more time. Let's give ourselves more time. There's no reason for us to have a hard fixed date right now. We're doing a lot of good work right now. I don't want to see that hard flush down the drain. And I can tell you right now, I will be completely furious if we close down this encampment and another one pops up again. That's all I have to say.
Councilor Fish.
I know last year we tried to close the encampment and we postponed and postponed and postponed it. And when we had our lowest count of time, we were going to try to create some type of control over it to better manage it, not, you know, just for the city, but for, I mean, it's inhumane living conditions there. It's not just the crime, but other people that have gone there, they have felt that it's not a place for them to be there for safety reasons. It's, you know, it's all the trash and everything. It's just not a healthy place to be. And last year we put it off and it got worse and worse and worse. So I think to see and hear these reports about the progress we've made with a date, we need to stick with a date. And I know from Portland, from my contacts in Portland, their overdose numbers went down significantly. And the cooperation with the people that are on house and on the streets, the relationships have improved greatly, that they have collaboratively worked with other outreach programs, and that has encouraged them to work together more beneficially. And I think as long as, you know, we humans are human, we're always going to have homeless. We can do all that we can to minimize it, but we probably will have an encampment, but at least maybe now we're learning from this and we can have a better strategy to better control it. But that's my thoughts from the past year of working on this.
Anybody else? Sam, I'm just
Okay.
saying if anybody else wants to say anything. Council Leonard.
Just really quick, in the state of Maine, homelessness has risen 65%. If we close this encampment, another one's 100% going to come, especially considering with the next administration coming in, there's going to be probably not as much help for this particular issue. Just putting that out there.
We have several encampments within the community. This is not the only encampment within the community. But it has been 4+ years. And we will continue to provide services. I agree, you don't want to lose those connections and that ground you've made up. But if we can work with them to the end and facilitate where another place could be and to get folks inside, I don't think any of us want to be in the middle of January or February and continue to have folks outside. We are going to have them. There will always be individuals who are homeless for one reason or another. I think it would be really short-sighted of any of us to think that we will never have homelessness. It has always existed and it always will. And what we need to do is to manage it better in our community. And the work that Jenna is doing and Jen and any number of direct service agencies are going to help us to better manage the folks who need the additional support in our community. And that's our goal.
I just want to make sure that, you know, what I have to say, I'm not conflating the work that's being done with the date. I'm only talking about the date.
Yep.
And, you know, we can, you know, talk about, you know, the date help people engage. Okay, well, they're engaging now. We don't know what December 31st is going to look like. You know, last year, you know, with the way that went down with the green X's and everything, a lot of people just self-relocated out of the confusion of it all. But they went to other places in the city, and some of them came back. Closing this solves nothing. It just shuffles people around. It solves nothing. And if the morals don't get you, the money should, because the taxpayers are gonna have to pay for that. You gotta start these relationships over again. We have to go through all of that relationship building again. Takes time, takes money. We're just throwing progress away. If there's no gain out of this closure date right now. And yes, we could wait till February, wait till March. Again, there's no gain to doing it now. It just costs taxpayers money, and people will relocate. And they are gonna go to places downtown, they'll go to other spots, find other private property if they have to. But the Bangor residents will relocate, and we're gonna have to start over. And the only net change is that the taxpayers are on the hook for reestablishing those relationships.
The gain, I think, is in the closure date. We have brought out all the outreach that we did not have. And what I'd like is a promise from outreach that it won't end. I mean, will it, when we close the encampment, will we still have the same number of outreach people out there working with the unhoused, finding them and doing the same thing that they're doing now?
Yeah, and Deb, you can correct me if I'm wrong here, but the outreach workers that are out there right now, we have a city outreach worker that has been part of our team for a while, who's trying to link people to resources. That doesn't go away. The Path Outreach team that's on the ground and the home team on the ground existed before we decided on closing the encampment. What has happened is there's been a shift in prioritizing the encampment, that all Path Outreach workers are working in that one space right now, rather than being distributed. Now, Path and Home, they are funded by and run by different organizations in the community. So Path is under the direction of CHCS, Home is under the direction of PCHC, Crossroads, and others. So what's happened is, because of the closure, it's really put a focus in one area where there's now a high concentration of those outreach workers. So those positions won't be going away. They'll just be shifted to other parts of the city. Debbie, did you already mention the funding for Maine housing with a position?
That's like the next item.
Oh, okay.
It must be the accepting and appropriate. $50,000. Maine State Housing Authority Long-Term Solutions to Assisting People Experiencing Homelessness Grant.
Yes, so in September of 2024, the city council went ahead and authorized the city submitting an application to Maine State Housing Authority's grant program. And we submitted a grant request for $400,000. And we were awarded $350,000. And the money that they took out was out of our discretionary bucket, which was very large. So we applied for money such to hire a housing navigation and stabilization position. Because one of the things we know is we can get folks into housing many times, but we need them to remain in housing to be successful. And sometimes the landlords need somebody to check with, or they need to be a point of contact to share with somebody, to be a tenant here. This is sort of the expectation, and how can we help you be successful and maintain your housing? So we did receive that money. We also asked for money to do things like document acquisition, such as IDs, birth certificates, all the application fees that may be associated with a housing unit in Bangor. Now, clearly, the application fee isn't due until they've actually leased up, but you can't get that funded through general assistance or some of these other assistance programs. It's $75. They can tell you we cut a check 2 weeks ago for $75. Go like, yes, we've got somebody housed. Transportation, basic household furnishings. Really interesting to take somebody who's living in an encampment and put them in an unfurnished apartment. What do you think it looks like? It looks like an encampment indoors. And so, allowing people some basic furnishings to create a home
that they can sustain, that they can take pride in, and that they can, you know, reconnect with friends, family, or whatever is important. Moving services, right now, more often than not, it is the outreach worker who is helping somebody move, because it happens very quickly. So we should be paying professionals to do that. We should have outreach workers doing what they do best, making relationships. And then just discretionary funding, because you never know what comes up. Maybe today you've got an opportunity, you know, to get a job, but you need a particular type of clothing, or you need a particular type of safety footwear, or whatever it may be. Or maybe, you know, you had, you know, somebody who gave you a vehicle, but you need to get it registered. You need to get it, you know, well, let's not create a barrier. So we have quite a bit. So pretty happy that we received that funding, and that we're gonna hopefully be able to help people be more successful and sustain their housing. So it was pretty exciting.
That's great.
Yeah.
That's good.
So we do need a motion to recommend approval to council.
I'll make a motion to recommend approval to council.
I'll second that.
Been moved and seconded. If there's no objection, it will go to council, recommend approval.
Nice.
Last but not least.
You did not win the shortest meeting here tonight. I did notice that. I did notice that. I just wanted to make you aware, last week we were notified that DHHS actually scheduled a public hearing to implement a proposed rule. These are the rules. This is the mechanism the State Department's used to implement what they refer to as routine technical rulemaking, and really doesn't require legislative review. The city of Portland reached out and said, you know, there's some additional language in this that is concerning, that didn't appear anywhere in any sort of legislative directive, and goes above and beyond, you know, technical rulemaking. And what they in essence did is they inserted a cap on the amount of general assistance that a municipality could provide to a shelter. And it was really strange because it hasn't appeared anywhere else. So what they did was they capped the shelter benefit at the local rate of the 0-bedroom heated unit, which makes sense in some cases. So in Bangor, it really doesn't impact us because we have all congregate shelter settings, so we're below that maximum. But there are, for example, family shelters. And a family shelter could be a hotel, it could be a different kind of a living arrangement, which may be more than that 0-bedroom heated unit. And for example, if the city were, you know, to place somebody in a family shelter that was charging more than that, we couldn't pay the shelter rate because we'd be in violation of state law. So, you know, the thought is that the council might be concerned enough about that to submit some comments. The comment period is Thursday the 5th. Yeah, Thursday the 5th. So if folks are comfortable with that, we'd like to submit some comments to the DHHS committee, similar to what Portland does, but you know, to add this as technical rulemaking just feels way out of line.
You're gonna submit an opposition of.
Yes,
this.
correct.
Yeah, that makes sense.
And just to that one piece, most of the other changes that they're proposing are really related to the action taken in the last legislative session and are truly rulemaking, but we
Seems
believe
like
they've stepped out of the line a little bit.
A couple of years ago, they did something similar to this and it didn't go anywhere because there was a lot of opposition.
So the concern is that, you know, Bangor and Portland are really have always been very much about utilizing GA for shelters. Not every community is. I do think it's something we need to work with our shelter providers on, because if the shelter's in Bangor taxpayers paying for every one of them.
Yeah, right.
But if that shelter is being accessed by, you know, Town B should be paying for that for up to 6 months now, based on the recent legislation, so.
Is everyone in agreement that they submit an opposition?
Please do.
We get a motion, sorry.
No objection. You need a motion?
Please, just in case.
I'll move that, staff submits a comment in opposition.
I'll second that.
Okay, it's been moved and seconded, seeing no opposition. It will be
be done.
It will be done, yes. Get that negative out there. I believe that's the end of the agenda,
Yes.
so we are adjourned. Thank you all.